Welcome to Talk 1260 KTRC. This is Dr. Daniel Ronel. You're listening to Humanity Behind the Vanity, a show about plastic surgery and health and other things. I'm here with our very special guest, Mark Perry, and my wife, Betsy Ronel. And before we get going, I wanted to thank everybody for coming into the Vanity for Charity last month, where we raised a lot of money for a local school. And today, we're going to talk about the medical link and the medical benefits of hypnotherapy.
Great, Mark. Thanks for being here. We're so happy to have you. So, you have your own radio show, and just in case our listeners aren't familiar with it, tell us what time it's on and what day and all that.
It's Saturday mornings, 10 o'clock, on the same station, KTRC.
Okay, excellent.
It's called A Matter of the Mind.
Right, excellent. Okay, and Mark is very well known in this community anyway, so I'm sure most of you who listen to us have already listened to him. Anyhow, just in layman's terms, I'm not that familiar with hypnotherapy and all of that myself. I know just a little bit about it. But for people who aren't familiar, tell us overall, under an umbrella, sort of what it is and what it accomplishes.
Well, very simply, hypnotherapy is using hypnosis as a primary tool for therapeutic results in various realms that the mind can influence, which is broadly just about all of human experience. One of the probably earliest and best documented aspects of using hypnosis is in the medical area.
Right.
It's been an approved form of treatment by the American Medical Association since, I think, 1958. And hypnosis is really just a natural ability we all have to shift our state of consciousness. So part of my job is to help people become more familiar and more skillful with that ability and use it for whatever, fears and phobias, people who are in pain, dealing with surgery preparation. There are a number of applications that are commonly known: quitting smoking or losing weight, helping to change habits, or helping to achieve goals in your life in a more significant way.
That's excellent. Well, I think I had hypnosis done once, and I felt that I was kind of resistant to it. What do you do? It's not that I didn't believe in it. I was just kind of scared and sort of freaked out. How do you ease someone who definitely wants it, but doesn't get it? You know what I mean? Doesn't feel it.
Yeah, typically there's a combination of education and technique involved with that.
Okay.
Usually when someone has fears about hypnosis, it's because they've bought into one or a number of myths. There are a number of myths about hypnosis that pop up in movies and books, and the entertainment style of hypnosis promotes illusions about what hypnosis is really about. So getting clear on what are the fears about, educating appropriately with that. And then, not all of us respond to the same kind of guidance.
Right.
So, so having, shall we say, a full bag of tricks available to me that I can explore with my client and find out what are they most responsive to, and then helping them to learn to become more self-sufficient for themselves and guiding themselves and practicing with themselves, that's an important part.
How do you discover what people are more responsive to?
By trying things out.
While they're in the state or beforehand?
Well, as part of guiding someone into the state of hypnosis.
Oh, interesting. Okay.
There are certain techniques that you might call my go-to techniques that most people will respond to. And if someone isn't as responsive with that, that doesn't mean they can't or don't have the ability.
Okay.
It just means that they're maybe tuned to a little different type of technique. And so we'll go through a few things until we find what works best for them.
Do you tape the sessions?
Sometimes I do, sometimes I don't.
Okay.
Depends a little on what my clients want.
Okay. Excellent. All right, I'll throw it back to you, Daniel, so you can talk about medical stuff. I just was interested, and I'm sure I'm not the only one that's not 100% clear, but wants a little more information. So, okay, Dr. Ronel, you're on.
I got introduced into medical hypnotherapy when I was a pediatric resident at Boston Children's in the emergency room. One of the emergency room doctors would use hypnotherapy to talk kids down to make them calm when we had to do a procedure on them, because they're so scared in the emergency room. And it's fantastic, and it's really just like telling them a story. And he taught me some very basic things that I used when I was in practice as a pediatrician. It really helped. For my surgery patients, there are so many anxieties that they have.
Sure.
And some of them are really resistant to going forward with the surgery because they're afraid of things that they don't even understand. And I think that would be perfect application.
Yeah, absolutely. I would imagine in some cases maybe they're able to articulate something about their fear. In some cases they're fearful and they're not even quite sure what it is.
Right, right.
But they know what they're feeling.
Yes, they are.
And they're associating that with whatever it is you're telling them about, really whatever it is they're imagining about that.
Yeah.
So yeah, that's one of the, I mean, whether it's the type of surgery you do or other areas of medical procedure, there's obviously a lot of fear out in the world about that kind of thing. Some of it may be based on someone's past experiences. Much of it is just based on what's imagined, what they hear from someone else, what gets promoted.
Right. Childbirth
Childbirth is one of those areas. There are many cultures in the world where childbirth is a relatively graceful, relatively painless experience,
Yes.
but in our Western culture there are these ideas promoted, and so that's an application. And so often I'll work with people in advance to help them get more clear about, in a feeling sort of way, about what it is that fear is coming up about and help them make a shift about that. Interestingly enough, even if they don't have a rational understanding of what it's about, it's still available to make a shift about that. And that's important for the procedure, not only for their comfort level, but also for the results of the procedure.
Absolutely. If you have less anxiety, you have less pain post-operatively. Another thing is, I have patients who aren't afraid, but they really want guided imagery. They want to visualize healing. They want to visualize, you know, their tissues coming together and their cells fighting off infections, and that's a form of hypnotherapy also.
Absolutely.
Some patients come in with tapes, listen to it while they're having their surgery. Do you do that with?
Yeah, that's one of the things I'll make. I'll if someone comes to me for a combination, my ideal picture is someone comes to me far enough in advance of a procedure that we can help them get fully prepared for the procedure, have something that serves them during the procedure, and supports their greatest healing after the procedure. And oftentimes I can create something in the form of a CD that will cover all of those bases, or there may be 3 stages of things that I prepare for them. It depends on the person, depends on the procedure. But it's remarkable how well that works for people, again, not only in their experience of what they go through, but also there are a number of studies that have been done in recent decades that reflect that using hypnosis for a procedure can lower the amount of post-operative infection, can accelerate the rate of healing, and can keep people in more comfort while that healing process is going on.
Absolutely. How do people reach you if they want to call you and talk to you?
They can call me in Santa Fe at 920-6149, or they can find me on the web at amatterofthemind.com.
And listen to your show on Saturday mornings at 10 a.m.
That's right.
Okay, you've been listening to the Humanity Behind the Vanity. I'm Dr. Daniel Ronel. We're here with Mark Perry and my wife Betsy. I wanted to thank the makers of Artifil, Suniva Medical, and the makers of the iFlow pain pump for their generous support. And we'll be back in a few minutes. Stay tuned.